the big picture of all of the discussions of what the participants and the topic masters and topic assistants and glossary editors and others that have spoken before, I'm going to pull it all together into a coherent whole. So I'm going to go ahead and share my screen, and then I'll share the short presentation with you. Can you all see my screen?
We can. If you put it on slideshow, then we'll be able to see the slides more clearly.
Wonderful. Okay. So I'm going to go quite quickly through some of the structural issues and how that relates to what came out of the discussions. But since you've already heard from Margot and others about how these sprints were structured, I'm not going to spend too much time talking about that. I'm really going to talk about how did we get from these sprint collaborations to insights that will inform the development of this draft public health research agenda on infodemic management. So, just to take a step back, where infodemiology and epidemiology meet is really a starting point for discussion. WHO, as well as organizations like US CDC and many other Centers for Disease Control around the world, we're all about two components of public health response. That's surveillance and outbreak response, and ensuring that we have strong health systems to address both issues simultaneously. And so we wanted to think about this epidemiological frame of thinking as a starting point for informing this conversation about what is infodemiology. And really, whether it's infodemiology or epidemiology, you use tools and methods and interventions to support behavior change to flatten the curve. There's no epidemiological outbreak that you can solely win through just pure medical intervention. You need people to change behaviors. And that's something that I think we have in common between both epidemic management and infodemic management. So as you can see from this is an epi curve, and there's these different phases along this epi curve of preparing, monitoring, detecting, intervening, and strengthening. And what underpins all this is an enabling environment that allows you to do this successfully. And again, this is not a perfect one-to-one match up between epidemiology and the language of epidemiology and infodemiology, but it is a helpful frame as a starting point. And so, for example, when we talk about surveillance in epidemiology, we think about listening in infodemiology. When we think about virus or pathogen in epidemiology, we think about narratives and data and information. And similarly, when we think about disease and how it manifests in groups of people and populations, we can also think about how does trust and mistrust and distrust affect populations. How does misinformation affect populations? And then, of course, what we have in common is this idea of interventions, that we need to develop tools and approaches that will help people make decisions to improve their health. So we've already talked about how this entire conference was set up, which was really connecting across fields, geographies, and experiences, and sharing perspectives on these key areas around 1, the information environment, 2, how information and misinformation spreads, 3, how information affects populations, and then 4, intervention development. But the point of all this discussions was to really identify and prioritize these key areas of research to yield short and medium-term insights to aid a more robust COVID-19 pandemic response. We don't have the luxury of time to develop insights that will take 5 years for us to reach a conclusion on. And I think this is where the strength of this conference really comes in, because we had so many perspectives in the room, now not just scientists from many different disciplines, but also we had people from the room who are implementers. So WHO country staff, regional staff, other UN agencies were also participating. We had other public health stakeholders in the room who really tried to connect these dots between the science and the implementation. So what it came down to is we had 14 fields, 52% female, people from 22 countries, and just comparing notes. And what we really try to do is color in this elephant, of this idea of we're not just blind men touching the elephant, but we're now comparing notes and coloring in the elephant, which is this field of infodemiology, which we're defining together. How does that fit into building the research agenda? So first of all, we want to take into account that whatever recommendations or proposals that come out of this meeting, it really needs to fit into health authority processes, whether it's a Ministry of Health or a CDC or other health authority in country. These approaches need to fit into processes that already exist, just like every epidemiological response fits into a specific systematic approach. And so the systems approach is really what we wanted to emphasize. And a lot of the conversations that came through over the course of these sprints really highlighted different points along this response chain that would be useful to consider when we're trying to build an infodemic management along epidemic management. So, it's going from social listening to understand the public's concerns and misinformation to delivering high quality health information, applying interventions, toolkits, and methods, countering misinformation and disinformation, monitoring the information environment and responses, and supporting healthy behaviors and resilience to misinformation at the individual and community levels. And then, of course, this should all be used to strengthen this outbreak preparedness and response in acute health events. And all of this is a process. This is not an end state. Like most things in public health, it is not an end state, it's a process. And we need to continuously refine this process over time, which is why building this research agenda is really critical. So there are some cross-cutting principles that we did want to highlight that came through in all of the discussions that we really wanted to use as a starting point for thinking through this research agenda. First of all is this idea of ethical conduct, and that we really want to reduce unintended harm. When you do any kind of public health intervention, you can have unintended harm, and we need to do as much as we can to reduce that. We need to empower individuals to have to access the information that they have a right to support healthy behaviors. We want to think about the needs of humans and individuals and communities, and make sure that approaches are acceptable and context appropriate, and to promote resilience against misinformation. Misinformation is usually exchanged one-on-one, and that's really where we need to be working at the community level and at the individual level. And how do we build resilience between individuals and communities, and not just a top-down approach? And then really there's this idea that we need to think with a heavy bias towards action, that we're in the middle of a pandemic and we desperately need to come up with more evidence-based tools and approaches that will enable us to better deal with the infodemic that we're currently in, to really enable this timely and effective response. And then ultimately, what do we want to do over the long term? Strengthen health systems to build trust and ensure healthier populations through better infodemic management. So I already showed you a previous version of the slide, and you can kind of see how we've taken all of the discussions and mapped them onto these 5 streams. And stream 1 is measuring and monitoring the impact of infodemics during health emergencies. Stream 2 is detecting and understanding the spread and impact of infodemics. Stream 3 is responding and deploying interventions that protect and mitigate the infodemic and its harmful effects. Stream 4 is evaluating infodemic interventions and strengthen resilience of individuals and communities in infodemics. And stream 5 is promoting the development, adaptation, and application of tools for the management of infodemics. So this is a very busy slide, but this gives you in a snapshot where this draft public health research agenda is going in terms of thinking through what are the different areas of focus that we need to consider. As you can see, we really have our work cut out from us from stream 1, which is really about standardizing taxonomies, developing metrics, analyzing and triangulating data sources, improving evaluation approaches, to stream 2, which is really understanding about detection and how do we understand spread and impact. We want to understand how does information and misinformation originate and evolve, what are the role of actors and influencers and platforms and channels, how does misinformation affect behavior in different populations, and what are some regulatory and ethical principles that can help mitigate the spread and propagation of harmful health information that we should consider. Stream 3, which is about responding and deploying interventions that protect and mitigate, is really all about where the rubber meets the road. How do we come up with better ways to support the sharing of credible, accurate, and compelling health information versus the compelling yet inaccurate and non-credible misinformation that seems to really drive this infodemic. And thinking about interventions at all levels: individual, community, societal, and health systems interventions. And stream 4, evaluating the infodemic interventions, we really need to do a better job at measuring what we're doing, and then continue doing the things that seem to work and stop doing the things that don't. That includes the development of interventions that really address all different levels regarding trust and resilience to misinformation. And what's key is thinking about how does misinformation affect behavior among different populations and in different contexts for specific infodemics. Several speakers have already highlighted this, but we have to remember that infodemic does not equal the internet. It does not equal digital. There are communities who are unnetworked, who are hidden, who are at risk, who are vulnerable, who are offline, who are heavily affected by misinformation, even if it's not coming through WhatsApp. So the point is that we really need to ensure that we are collecting data and understanding impact of misinformation of all communities, not just those that we can easily find online. And then identify factors associated with a successful infodemic management by health authorities, media, civil society, private sector, and other stakeholders. Right now, not a single country on earth has an infodemiologist on staff, and that's because the discipline really doesn't exist yet. We recognize that we need many different skills and many different kinds of learning and approaches to be able to successfully deal with the infodemic. And as you can see from this list, it's a pretty robust list for our to-do list. And then finally, how do we promote the development and adaptation of these tools for management of infodemics? And that includes using implementation research evidence in program improvement and policy development, promoting evidence-based interventions and approaches between countries, and then improving effectiveness and response times to the infodemic during acute health events. And so this is just a snapshot of where we started, where we've gleaned from all of these discussions from the sprints and turned them into areas of research. The next step will be, you'll see. So what we're going to be doing is we're going to be completing this research agenda with additional scientific stakeholders by mid-September. We will be developing a review of evidence in the 5 work streams of the agenda, develop a community of research and practice to foster connections, repositories of tools and resources, and track implementation of the agenda. And we hope that you will join us when that is launched. And then finally, develop competencies and a framework for an infodemiology skill set and develop online training tools so we can make sure that all of this hard work on developing approaches for infodemic management can be disseminated as widely as possible, and as many people as possible can be trained on how to do this successfully.